Hello everyone, welcome to DocEngage. This is Jayashree. In this video, I'm going to explain you about Homecare appointment management system. Here you can manage all the home care appointment with patients and can track them easily. If any patient calls to your clinic or hospital for home care appointments, then you can book an appointment by following the steps which I'm going to show you now. Click on create and book appointment from, or even if you have any website with appointment booking form, then we can integrate with DocEngage. Once it is integrated, then patient can directly book appointment from your website and all the appointments will show in the DocEngage. Now let us see how to create appointment for the patient who has called to our clinic for the appointment. So let me select a patient called Sanjana. I have selected the patient. Now I'll add the service. I can add the service or I can create even add the package. I'll show for service. So if I add for the service, here it is showing service type. I can select the service type. I'll say as in the service name, it will show only the services which are related to the service type which I have selected. And the service name is CO2 lasers. So for this patient called Sanjana, I'm going to create an appointment for CO2 laser treatment. And what is the time and date? So I'll create this for 16th of November and 12 p.m. I'll select the time as 12 p.m. And what is the duration for this particular appointment? So I'll give 30 minutes. And who is the provider who is going to uh, attend this take this particular appointment, and what is the repeat each, how many hours we need to repeat each appointment, and what is the units of visit. So let us say for this particular service they have to visit 3 times. Write the visit type 3, visit number as 3, and repeat each 2 days. So 2 days once an appointment will be directly created for this particular doctor called Ankit in their schedules, and number of appointments will be 3. And in the appointments, you can see I have given the visit type as 3, and it is showing for the 2 days, 16th, 18th, and 20th. So it will repeat for 2 days. 2 days once it is repeated. I can even edit this and change for if I want to change the provider name or any other details. I can even edit this and change the date also. And then the work list, if the provider has to do some certain work, has to complete certain work list, then they can we can add the work list to here. For example, I'll give one more example, like the patient who has got injured and he is going to take the home care services. For that particular patient, the provider is going, like let us say nurse is going for to give the service. And for the nurse, we are creating some work list, like we have to change the dressing for the injury, and we have to change their clothes, or we have to give them a bath with a sponge. All these things we can add in the work list. And once the provider has completed all these things, they'll check this while doing the chatting. So I'll write this dressing I can do, or cleaning. If I want to give cleaning, I can add that also. And in the outcome is nothing but we are giving some assessment forms to the provider to fill. So whenever the provider is going to attend a patient, and when they're doing the chatting, they need to do some certain activities. They need to fill some certain assessment form that we can add in the outcome. Like if there is any precondition, we can add the preconditions. And also in the outcome, this is the assessment form. Right now I only have blood donation assessment form, so that is showing here. If we create more assessment form, all the assessment forms will show here for the provider. And if there is any instruction or SOP, we can write the instruction for the provider and save. Or also I can use save and add one more service. Right now I have added only CO2 laser treatment. If I want to save this particular appointment and I want to add one more service and add one more save this particular service and add one more service for this particular appointment, then I can do that also by just save and add service. Now one more service has service page has come here. I can again select the service type, service name, and do the up then again add the service for this particular appointment. Or I can also directly create the once the appointment is done, I can directly create the invoice also. Or I can even discontinue for if the for some reason if the patient discontinue, we can discontinue directly from here only, or cancel also. I just want to click on back. Appointment has been created and that appointment will show in the provider calendar. So we can see for November 16th, I have created one appointment. So this is the appointment which I have created. If I see in the week wise, so on 16th there is one appointment, on 18th there is one more appointment. If I go to month view, I can see for 28th there is one more appointment with the Sanjana on the same timings. If I want to change the timings, I can change the timings all as well. And after creating appointment, as usual, the provider can go into this provider calendar and start doing the check-in. Once they do the check-in, it will redirect us to the chatting page where we can add vitals. So all the work list which I have added, it will show here in the work list in the chatting page. If I have done dressing, I can check this box. If I have done cleaning, I can do this. I can check this box. And if I want to add notes, I can add notes and the prescriptions, vitals. So all these activities I can do here. And then just do checkout, or if I want to do save and print, I can do the save and print. This thing will be as usual. And also assessment form which I have added will show in this chatting page. We can fill the assessment form and then do the checkout. So I hope you all understood how to create an appointment for the home care patients and how to start the chatting. Same as usual, we'll go to the provider calendar where we can see all the appointments which is there for a particular provider who has logged in. And from there, we can start doing the check-in. And after completing all the chatting, writing prescription, adding notes, capturing vitals, then we can do the checkout if the service is completed. Right now I have done check-in. That's why the status is in checked in status. So I hope you all understood. Thank you all. See you in the next video.